Buffalo Bills safety Damar Hamlin's collapse during a nationally televised game prompted a wave of support, but it also sparked a wave of misinformation.
Anti-vaxxers and other critics falsely linked the player's medical emergency to spread lies about COVID vaccines and boosters. This was not the first time that has happened. Last month, the sudden death of sports journalist and friend of all of us here at CBS, Grant Wahl, prompted a similar spike in misinformation. Wahl died from a ruptured blood vessel in his heart while covering the World Cup games in Qatar.
His wife is Dr. Celine Gounder. She wrote an op-ed in the New York Times criticizing the dangerous and destructive way anti-vaccine theorists are using tragedies to get their message out.
Dr. Gounder is the editor-at-large for public health at Kaiser Health News. She is also an infectious disease specialist, an epidemiologist, and a CBS News medical contributor. And she is here with us in the studio to talk about her piece, her personal experience. Celine, we are all wrapping our arms around you and are devastated by the loss of Grant, and then further devastated to hear that you're not just that his death is being used to promote this misinformation, but personal attacks on you because you have been, in your role as an epidemiologist and infectious disease expert, talking about the benefits of how we can, as a society, protect ourselves. And I'm just going to read for our audience, in case they haven't read it. You wrote, when disinformation profiteers leverage tragedies like Grant's and Mr. Hamlin's for their personal gain, they re-traumatize families, compromise our ability to interpret information and distinguish truth from lies, and put all of us at risk. And so we want to give you an opportunity to talk about what you've been experiencing and why you feel it's necessary after dealing with your own, well, continuing while dealing with your own grief, to speak publicly about this.
Well, in my role as an epidemiologist, as an infectious disease specialist, I have been getting all kinds of harassing messages for several years now, including rape and death threats. But this is the first time it felt so personal that they were trying to exploit my husband's death for their own business, essentially, because disinformation is a business. It is about making money or gaining followers on social media platforms or for their Substack, some kind of social status or power. And I am not going to let them disrespect my husband in that way. He did not deserve that, and I'm going to protect his legacy.
So you call them vaccine disinformationists. Give us some specifics here, because it may be hard for some people to recognize if they are in fact being manipulated. How is it that these vaccine disinformationists, as you call them, are manipulating data to essentially spread falsehoods, not just about COVID vaccines, by the way, but other vaccines as well?
So there's a playbook here for vaccine disinformation. And so those of us who study this know what to anticipate and what to look for. Fake experts is one. So just because somebody has an MD behind their name does not mean they're an expert. There was a propaganda film on vaccines, excuse me, that came out recently in which they used funeral directors and coroners as experts on vaccines. They are not experts on vaccines, to be very clear. Impossible expectations is another common such tactic, which is why even after the FDA fully approved the vaccines, you have people continuing to move the goalposts as to what is evidence that this is safe or not. A couple others are what we call logical fallacies or cognitive biases. There's a whole host of those. The most common is just because A happened before B does not mean A caused B. And then you have cherry picking of data and conspiracy theories. So if you know what to look for, you actually find these patterns over and over and over again.
Yeah, the people who are doing this may feel like, you know, this is for social media. This is, you know, but there's real implications, not just in the re-traumatizing you and other families who are experiencing grief at depths that it's hard for others to contemplate, but that it's also having real implications in terms of health, particularly for children. The Kaiser Family Foundation took a poll on where the public now stands on childhood vaccines, including those for measles, mumps, and rubella. What can you tell us about that?
So I am a senior fellow at the Kaiser Family Foundation, and our polling team found that while the majority of Americans still support vaccination for measles, mumps, and rubella, there has been a significant drop in support for those kinds of mandates for children to attend school in the last 2 years, so over the COVID pandemic. And that really does put all of us at risk. We've seen a large outbreak emerge in Ohio of measles among children. We've seen the resurgence of polio here in New York State, where we are, among under-vaccinated populations. And then in December, you had Congress that repealed a COVID vaccine requirement for the military, which really does harm military readiness and puts our national security at risk.
You know, Celine, I just want to give you another opportunity to address those critics out there and even some folks who just might be a little bit skeptical, right? Who maybe haven't gone full on with respect to the vaccine denier kind of mentality, but who are just distrustful. What would you say to them as an epidemiologist and also as a grieving widow about some of the information that might be coming their way that they might be skeptical about?
Well, I do understand some people have very good reason to be skeptical of the healthcare system. There is a long history of medical racism in this country, of inequitable treatment towards certain groups. And so I think it behooves us as physicians, as epidemiologists, public health workers, to understand that, to do outreach. But at the same time, weaponizing my grief for your profits or ends is simply not okay. And I think we deserve better in a situation like that.
Dr. Celine Gounder, we continue to keep you close in our hearts and thoughts. Thank you.
Thank you.